Any problems with the sound?
Hello, Dr. Leonid. Everything is fine from my side.
Yeah, great. Thank you. So let's start. So hello, dear colleagues. My name is Leonid. I am thank you. My name is Leonid, and I'm an emergency physician from the float team. And the topic of this meeting will be about COVID-19 connected myths. Before we start, let me ask you to add to this meeting anyone who can be interested in this topic. And if you have any questions, write them down to the chat of this meeting so I can answer them on the end of this meeting. So let's start. For a year now, the World Health Organization has declared the COVID-19 pandemic, and one of the threats beside the COVID-19, World Health Organization considers infodemia. It is a spread of misinformation about the COVID-19. There are many reasons for this situation, but the main result of this situation is a undermining of public confidence in the state institutions. Can be manipulations, falsification of facts, out of the context, loud populist statement, and the main result is non-compliance with the recommendations and roadmaps to overcome the infection, and as a result, increase of the number of victims. Can be many reasons for this situation. It can be political, increase of the coverage of your own media, attract traffic, advertising, and anything else. One of the important part of the epidemic is the spread of myths. Myths is basically the false belief or idea that is created by a man. It is a normal reaction that appears when humans face something supernatural or some process in the nature or animal behavior that they can't understand. For example, storm or lightning, it is an anger of gods or evil spirits that make a bad harvest. This idea fits most of the humans and they move along. And the COVID-19 pandemic is a supernatural event that affects anyone on this planet. And it is very hard to understand. And humans try to find some clues and signs that can make the understanding of it a little bit easier, as that's the main reason why the myths and theories appears. Also, there are important part of this presentation and the infodemic. It is a cognitive or heuristic distortions. It's a distorted decision-making algorithm, search and interpretation of information, and as a result, erroneous conclusions or irrational actions. That there are many cognitive distortions, but now we talk about the ones that are most harmful to health and treatment. For example, it's availability bias, that we take what is at hand, the tendency of it, or attach unreasonably high value of information that has recently been used. For example, to do CT scans for everyone in context of COVID-19, it's a very popular decision, and prescribe blood thinners for everyone because some patients really need it. Conjunction rule, the rule of coincidence, when it seems that the phenomenon is caused by several reasons because it is more likely than one reason. Search satisfying, it's a point of in the search. Be content with the first pleasurable assumption, and commission bias, to think that it's better to do something or than not to do. For example, it's a prescribed medication just in case. So let's move to the myths. As you see in this picture, this is one of the publications from one of the Ukrainian sites. And the main idea is, the main myth is that COVID was created in laboratory and it is a biological weapon. So as small history, I looked for a live example of the actual myth of the COVID-19, and there are a lot of information for this year was received by me and my colleagues, and we discussed it. And before this presentation, I tried to find some actual myths, but nowadays search platforms as Google and social media as Facebook, Twitter, they try to fight the misinformation and stop the infodemic. They try to work with the governments and other organizations, with the World Health Organization and the UN, to try to help them and stop the spread of the infection and try to make not so much people affected with this virus. And it's very hard to find some interesting conspiracy theory, but like a month ago, I was in Kiev and find the sticker on the one of the metro stations that was told me that, and there was information on the sticker that Bill Gates is created COVID-19 and the vaccination is a chance to insert some chip in everyone and control all of us. And I think it's a very good life example of conspiracy theory, because it's we understand that it's circulating, and some people, some men decided to make stickers and spread this information. So it is life example. So is the COVID-19 was created on laboratory, and this is biological weapon? Short answer is no. So the last report of the UN and World Health Organization about the COVID-19 tell us that no, it is more likely not a biological weapon, or it was created in laboratory. It's a result of many factors. So let's talk about first one. The coronavirus exists with the humans more than 2,000 years. We know that we started the study of the coronavirus in the late 30s in the US. It was happened just because there was a massive death of chickens on the farms, and the local farmers asked scientists to understand why it was happened. And this time, some virus was indicated, it was described, and it was the start of the history of the studying of the coronavirus. Later, in 1966 and 1967 in Great Britain, when the electronic microscopes become more widespread, the first photo of the coronavirus was received, and at the time the coronavirus was called coronavirus. For now, we know that there are 4 general strains are circulating as a part of the common flu. So every time when we have the autumn and winter period, the rise of the common flu cases, the 4 strains, one of the reasons are these 4 strains of the coronaviruses. And then on the next slide, I know that we have some technical issues. Oh, thanks. So, for example, this is a screenshot from the Swedish Health Ministry. So you can see there are 4 strains of the coronaviruses usually persist, and this is information for 2019 year. So there are 4 types of coronaviruses are circulating during the common flu period at the autumn, winter, and the beginning of the spring. Besides the usual influenza virus and other viruses that cause so-called common flu. So what we know also that there was before 2 big epidemics of the COVID, of the coronaviruses. First was a SARS epidemic, is a so-called younger brother of the SARS-CoV-2 that caused COVID-19. It was in 2013. It was happened in the Korea and China. And for now, it's like we still have local accidents of SARS infection, but it's not very dangerous. And when we have this So we have studied the SARS virus, and after that we described it, and we for that period was some researches about vaccine made, but as the spread of the infection was stopped and there are no case of big epidemic of SARS, so it was saved for the future, and maybe we will touch this theme later on this presentation. Another thing is a MERS. It's a Middle East respiratory syndrome. It's also caused by coronavirus, and for now we know that it happened in the Middle East. We know when its exact came from. It was passed from the animals to humans in 1997, and after that it caused an epidemic in 2003. And also we still have cases of infection of MERS, and still it kills from nearly 100 men during every year in that region and in Korea region. So is the main question is, can we blame Bill Gates for something? Not, but because there are what the situation with Mr. Gates, because he's a rich person who can he has a lot of money, and also he's a visionary, and he maybe some understand and why many people blame him, because he has have made some statements before, because there are no main idea that there was no big pandemics for the last 100 years. Every big step in our human history was also there was one episode of a big epidemic, and the last epidemic, as we know, was a Spanish flu in 1918, after the World War One, the First World War. And there was some harbingers for the last 50 years. For example, it was an episode of Ebola virus or Marburg virus. We have SARS and MERS, and what this means. There was a small local epidemic, but there are informed that as we as humanity get bigger, we go deep to the jungle. We act somehow with some animals, and we go to their territory, and of course we will act with the virus that they have. And as we speak about coronavirus, for example, SARS and MERS, they are all come from the animals. That, for example, SARS, it was we know that some people that hunt animals in the China, from at the one period, the virus came from the animals to people that circulate during in the people, and after that it evolved and becomes SARS and causes the epidemic. So the blame is for Mr. Gates is that he just understands the tendency, and that there are find some harbinger and try to warn anyone that there are big chance of the pandemic, and that it will happen, and that's why everybody like try to blame him. So I hope this I described this myth. So let's talk about other myths. One of the popular myths that appeared in the start of the pandemic is that my pet can infect me with the COVID. And the short answer is no, but the bigger answer is that the cats, dogs, and mouses, they have all their own strains of the coronaviruses that circulate among them. And there are no chance for no episodes when the cats, dogs, and mouses coronaviruses can infect people. But if someone who infected with the coronavirus will touch some cat, it can be stored on the fur of this animal and can infect others. But for nowadays, we know that this type of transmission it's not very often, and the main type of transmission of the coronavirus is through the droplets, as because it is a respiratory infection. The next popular myth is that can be some kind of a COVID-19 prevention. For example, using garlic, it's a very widespread national method, or some chili pepper. Unfortunately, no. There are no evidences that that you can take something and that can prevent you from infecting COVID. But we know that if you use hand hygiene, use face masks, and alcohol-based antiseptic, it can lower the chance of you to be infected with the COVID. But that there are no kind of prevention of COVID, but this is not a reason to refuse to taking vitamin C or D, especially in the winter, especially in the Ukrainian region, because we during winter have not much sun, and not a reason to give up sports. It's make your immunity more stronger, and not reason to deny yourself a good nutrition, because we know that the good nutrition is very well connected to your immunity abilities of your immune system. There are also other myths, sorry, but this is Ukrainian. So there are was popular myth that that COVID can be spreaded by if you touch some fruits in the shop, when someone infected is touch these fruits, and you can receive COVID from these fruits. No, as we know, as I told previously, this was not a most so-called popular method of spreading COVID. And if you wash fruits and other things that you came from the shop to home, there are not much chance for you to infect with the COVID-19. Also, it's about money. Also, at the beginning of the COVID pandemic, there was information that it can be spread by money, but paper money, especially paper money. But now we know that if you wash your hands regularly and use alcohol-based antiseptic, there are not much chance for you to be infected. Also, there was a myth that if you receive some message or letter from the China, you can be infected with COVID. And also it's a myth, because we know that virus is become inactive from some time, and even if someone like really put some virus in the letter, it will not survive the time. With time of the time when the letter is traveling from the China to, for example, Ukraine. So there are not much sense for you to be worried about this. So the next popular question is COVID and alcohol, and it's very popular in our region, for example. And the main popular myths are alcohol can improve your immunity, or that alcohol kills the viruses in the air around you, and that helps you to find infection, but not. And there are many information we have now. So even there was a fact sheet created by UN that about alcohol and COVID-19, and what we really know that alcohol reduces the level of criticism, and if some, for example, of your parents or friends who have COVID, they try to take alcohol, they can not find the warning signs, and that will be the reason that they will not call the physician, and they will not get needed medical attention at the time, just because they take alcohol, and this is reduce the ability to respond quickly and adequately. Also, if you have some psychological problems, the intake of the alcohol can worsen the symptom from this underlying psychological condition. And the receiving the alcohol increases the urge to smoke. And as we know, the COVID is a respiratory virus and it affects lungs. The smoking during the respiratory infection is a not good idea. Also, there are popular myths that, oh, not loading. This COVID-19 is a doom, but good news is no. We know that from 80 to 90% of the sick will carry the disease in the mild or moderate form, and they do not require hospitalization and fully recover by the end of the self-isolation. So if you have COVID, you can call us at the float hotline and we will try to help you, and everything will be fine with our help. So the next myth is that if you have COVID, it means that you have pneumonia. And no, yes, most of the patients with the COVID will have changes in the lungs, but it not required any treatment or therapy. And over time, these changes in the lungs will disappear on their own. And if we get to the point, this is not so-called pneumonia, this is changes in the lung tissue that's specific for COVID. And if you, for example, I have here a link for the Johns Hopkins medicine site that with description of what COVID does to the lungs. It's very, very interesting mechanism. And if you're interested, you can look. And I will share this link at the end of this presentation. The next point is what about antibiotics? And unfortunately, we have a big uncontrolled rise of the using of the antibiotics. And the main point is that antibiotics they affect bacteria, but COVID-19 is caused by the virus. So you don't need antibiotics. And most of the patients with the COVID don't need antibiotics. And if we talk about Mr. Gates that we mentioned previously, he has predicted that we will have a big problem with the antibiotic-resistant bacteria after the COVID-19 pandemic will end, and it will end. And after that, we'll face some problems with antibiotic-resistant bacteria because nowadays, if we use uncontrolled antibiotics and the bacteria becomes resistant for these antibiotics, and we don't have much antibiotics to left. And we are facing like a really, and we're now facing crisis, but it will be bigger at the end of the pandemic because we don't have much antibiotics to operate with. And the data that we are receiving now is very not so positive. So the main idea of this slide is that take antibiotics only by prescription of physician and only based on some lab, for example, lab test and other examination. Just in case, don't take antibiotics is a very bad idea, and think about the future. The next point of this presentation is the prevention of blood clots. Also a popular myth that so people come to the pharmacy store and then like we need something to prevent blood clots during COVID, or some neighbors can advise you, or friends that have COVID that can advise you to take some medication for prevention of blood clots. And the main idea that the risks of the harm overweight the potential benefit of taking these drugs. And now we have information from the beginning of the pandemic. There are rise of the cases of the intestinal bleeding among those who have COVID-19, and because of the people start to taking these pills, and it's not, and even they don't have really need to take these pills, but they take them, they overdose them, and as a result, they have, for example, if they have some underlying condition like ulcer or gastritis, it intestinal bleeding, and they die not of the COVID because of the blood loss. So the main idea is also take this type of medicine by the prescription of your physician and based on some laboratory test. For example, as you see, this Dr. Evil from the Austin Powers films. He's asked like, so what is PT and ENR? And this PT and ENR is important information that you receive from the blood test. If your physician want to prescribe you some blood thinners, so he needs to take this blood test to understand if you need or not. And remember, the risk of the harm is overweight the potential benefits in the big part of the patients. So next part is vaccine is created too fast, and it is very suspicious. And yes, previously, if we talk about implementing the vaccine to some disease, it was a long road. For example, if we talk about smallpox and other, but now we know that, for example, first of all, this is a result of the joint action of the doctors of the scientists around the world. So we have the supranational event like COVID-19, and nowadays we have all scientists in the world are gathering together and fighting the infection. Also, we previously mentioned SARS and MERS infection. We have some ideas and not tested on the human vaccines. And when the COVID-19 came in, so these materials and data that was collected during the SARS and MERS epidemics, it was involved used for finding the COVID-19. And also we have the scientific research that makes for the last years a big step. So we have a new scientific method, and this is why the vaccine was created so fast, like 1 year. So it was very cool from the scientific and medical part. And if you have a chance, please vaccinate yourself. If we the next popular myth is that masks can protect you from the coronavirus. No, but there are main reasons why we're wearing masks, because there are many cases of asymptomatic carriers of the coronavirus. And if you, for example, you're a carrier of coronavirus, but you don't have symptoms and you're wearing a mask, and someone who has not infected with the coronavirus and he's healthy and he also wears mask, and you keep the distance between you, there are not much chance for them, like 10 or 15% to infect them. So that's why we are wearing masks. With wearing masks and using alcohol-based antiseptics and washing with the soap your hands, so it stops the spreading of the infection. There are also myths that if you wore a mask very often, so you can be you can receive the overdose of the carbon dioxide gas, but now it is a myth, and there are no cases was reported about this myth. Some small advertise about our flood hotline. If you need if you have some flu like symptoms, or you have contacted with a COVID case, or you have confirmed their COVID-19 status, please call us. We can help you. If you're in staff or dependent, we can prescribe your medication. We refer you to the specialist. Also, we can help you with the hospitalization if you need it, and also we perform home visit, provide with the home kits if you're in Kiev region or cities that are around the Kiev city. So feel free to contact us, and also we have a psychological services available from Monday to Friday. So feel free to reach us, and if you have some question about COVID or vaccination, or you need some consultation, feel free to contact us. We will try to help you, and we will fight this situation together. So the references. If you have any questions, you can feel free to ask.